Contact sports in the modern world of today have evolved into a multi-billion-dollar grossing business that has influence in every level of society. Worldwide, contact sports are held to such a high regard. When a favorite or home team wins a significant game or championship, the town or city, and sometimes even the whole country, would shut down to celebrate the victorious feat. At the collegiate level, some schools have created a quote-unquote way of life, so to speak, when it comes to certain sports. Some colleges make most of their income and spend more money promoting their athletic programs in their efforts of finding that quote-unquote star athlete or golden goose. Some schools have taken it a step further by scouting and recruiting young athletes as young as 12 years old by keeping an eye on their stats through the years and during their progress. Financial or materialistic incentives are provided to influence the prospect athlete's decision-making on what school to attend, rather than spending marketing dollars on their academic programs. Reason being, capitalism and the monetary value and sources of income of the college tend to supersede their primary objective of providing and mainly focusing on academic programs and services. So while your favorite team is winning the championship, and you, along with your friends and family, spend millions of dollars a year supporting these platforms of contact sports, do you ever stop to ask yourself if these contact sport platforms spend millions supporting you? And most importantly, do they support your community? And the players who dedicate and sacrifice their whole lives and risk physical injury, are millions being spent by these contact sport platforms to protect the health of the athlete? I present to you C.T.E, the ultimate sacrifice. C.T.E was first described in 1928 when Dr. Harrison Martland described a group of boxers as having a quote-unquote punch-drunk syndrome. Over the next 75 years, several researchers reported similar findings in boxers and victims of brain trauma, but fewer than 50 cases were confirmed. In 2005, a pathologist named Bennett Amalu published the first evidence of C.T.E in an American football player, former Pittsburgh Steeler Mike Webster. Shortly after, the Concussion Legacy Foundation partnered with Boston University and the U.S. Department of Veterans Affairs to form the VA-BU CLF Brain Bank, led by Dr. Ann McKee. The Brain Bank has revolutionized how we understand the disease, with more than 500 brains donated, over 300 of which have been found to have C.T.E. The best available evidence tells us that C.T.E is caused by repetitive hits to the head sustained over a period of years. This doesn't mean a handful of concussions. Most people diagnosed with C.T.E suffered hundreds or thousands of head impacts over the course of many years playing contact sports or serving in the military. I repeat, it's not just concussions. The best available evidence points towards sub-concussive impacts, or hits to the head that don't cause full-blown concussions, as the biggest factor. Every person diagnosed with C.T.E has one thing in common: a history of repetitive hits to the head. C.T.E is most often found in contact sport athletes and military veterans, likely because they are some of the only roles in modern life that involve purposeful, repetitive hits to the head. C.T.E has been found in individuals whose primary exposure to head impacts was through tackle football, over 200 cases confirmed, at the VA-BU CLF Brain Bank, the military, over 25 cases confirmed, in hockey, over 20 cases confirmed, boxing, over 15 cases confirmed, and over 50 cases confirmed globally, rugby, over 5 cases confirmed, soccer, over 5 cases confirmed, and over 10 cases confirmed globally, pro wrestling, over 5 cases confirmed, and in fewer than 3 cases each in basketball and baseball. Athletes who begin playing contact sports at younger ages are at greater risk for CTE. Several published studies show that exposure to head impacts before age 12 is associated with worse outcomes than starting after age 12. Athletes with longer careers playing contact sports are at greater risk than athletes with shorter careers. Among those diagnosed with CTE, athletes with longer careers are more likely to have more severe pathology than those with shorter careers. There are very likely other risk factors that have yet to be discovered, including possible genetic differences that make some people more prone to develop CTE than others. More research will help scientists determine what those factors might be and could help us understand how to prevent and treat the disease. Currently, CTE can only be diagnosed after death through brain tissue analysis. Doctors with the specialty in brain diseases slice brain tissue and use special chemicals to make the tau clumps visible. They then systematically search areas of the brain for tau clumps with a unique pattern specific to CTE. The process can take several months to complete, and the analysis is not typically performed as part of a normal autopsy. In fact, until recently, there were relatively few doctors who knew how to diagnose CTE. In 2015, researchers from the VA/BU CLF Brain Bank, led by Dr. Ann McKee, collaborated with the National Institutes of Health to develop diagnostic criteria for CTE, so that any neuropathologist familiar with brain diseases can accurately diagnose CTE. This important work has made it possible for more and more scientists to be on the lookout for CTE, helping accelerate progress. Treating a disease that can't be officially diagnosed until after death is difficult. Luckily, there are lots of things that patients worried they have CTE can do to address their symptoms and find relief. Most treatments for CTE involving identifying the symptoms that are causing patients the most difficulty and treating those symptoms with targeted therapies. Mood changes, including depression, irritability, and anxiety, may be treated with cognitive behavioral therapy. Working with a cognitive behavioral therapist can help patients develop strategies that help them manage the particular mood symptoms that are causing the greatest problems. A variety of treatment options exist for headache, including craniosacral therapy, massage, acupuncture, or medications. Working with a doctor to determine the type of headache is helpful for determining the best treatment options. Memory training exercises, including consistent note-taking strategies, can be helpful for continuing a patient's activities of daily living, despite increasing difficulty with memory. If you think you or a loved one has CTE, I will provide a link in the description in regards to information and contacts. Fukando Amalu, born September 1968, is a Nigerian-American physician, forensic pathologist, and neuropathologist who was the first to discover and publish findings of chronic traumatic encephalopathy, C.T.E, in American football players while working at the Allegheny County Coroner's Office in Pittsburgh. He later became the chief medical examiner for San Joaquin County, California, and is a professor at the University of California, Davis Department of Medical Pathology and Laboratory Medicine. Omalu was born in Nonkwa, Idemili, South Anambra, in southeastern Nigeria on September 30th, 1968, the sixth of 7 siblings. He was born during the Nigerian Civil War, which caused his family to flee from their home in the predominantly Igbo village of Enigu Ukwu in southeastern Nigeria. They returned 2 years after Amalu's birth. Amalu's mother was a seamstress and his father a civil mining engineer and community leader in Enugbu Ukwu. The family name Omalu is shortened form of their surname, Onwa Malukwobwe, which translates to "He who knows, speak." Omalu began primary school at age 3 and earned entrance into the federal government college Enugu for secondary school. He attended medical school starting at the age 16 at the University of Nigeria, Nsukka. After graduating with a Bachelor of Medicine and Bachelor of Surgery in June 1990, he completed a clinical internship, followed by 3 years of service work, doctoring in the highland city of Jos. Omalu first came to Seattle, Washington in 1994 to complete an epidemiology fellowship at the University of Washington. In 1995, he left Seattle for New York City, where he joined Columbia University's Harlem Hospital Center for a residency training program in anatomic and clinical pathology. After residency, he trained as a forensic pathologist under noted forensic consultant Cyril Wedge at the Allegheny County Coroner's Office in Pittsburgh. Omalu became particularly interested in neuropathology. Omalu holds 8 advanced degrees and board certifications, later receiving fellowships in pathology and neuropathology through the University of Pittsburgh in 2000 and 2002, respectively a Master of Public Health in Epidemiology in 2004 from University of Pittsburgh Graduate School of Public Health, and a Master of Business Administration from Tepper School of Business at Carnegie Mellon University in 2008. Omalu served as Chief Medical Examiner of San Joaquin County, California from 2007 until he resigned in 2017 after accusing the county sheriff, who doubles as coroner, of repeatedly interfering with death investigations to protect law enforcement officers who killed people. An assistant forensic pathologist who joined the office for the opportunity to work with Omalu resigned a few days earlier, citing similar allegations.
Mike looked older than his age. He looked beat up. If I had not been told his age, I would say he looked like 70.
Omalu started at the feet and worked his way up. Webster's forehead was essentially fixed to its scalp. The skin on his forehead had built up almost a shelf of scar tissue that, from the continuous pounding of his head into other people.
Omalu's autopsy of former Pittsburgh Steelers player Mike Webster in 2002 led to the reemergence of awareness of a neurologic condition associated with chronic head trauma called chronic traumatic encephalopathy, or C.T.E., which had been previously described in boxers and other professional athletes. Webster had died suddenly and unexpectedly following years of struggling with cognitive and intellectual impairment, destitution, mood disorders, depression, drug abuse, and suicide attempts. Although Webster's brain looked normal at autopsy, Omalu conducted independent and self-financed tissue analysis. He suspected that Webster suffered from dementia pugilistica, which is a form of dementia that is induced by repeated blows to the head, a condition found previously in boxers. Using specialized staining, Omalu found large accumulations of tau protein in Webster's brain, which affect mood, emotions, and executive functions similar to the way that clumps of beta amyloid protein contribute to Alzheimer's disease. Together with colleagues in the Department of Pathology at the University of Pittsburgh, Omalu published his findings in the journal Neurosurgery in 2005 in a paper titled Chronic Traumatic Encephalopathy in a National Football League Player. In it, Omalu called the further study of the disease. We herein report the first documented case of long-term neurodegenerative changes in a retired professional NFL player consistent with chronic traumatic encephalopathy, C.T.E. This case draws attention to a disease that remains inadequately studied in the cohort of professional football players with unknown true prevalence rates. Omalu believed that the National Football League doctors would be pleased to read it and that this research could be used to fix the problem. The paper received little attention initially. Members of the NFL's Mild Traumatic Brain Injury Committee later called for its retraction in May 2006. Their letter requesting the retraction characterized Omalu's description of C.T.E. and I quote, completely wrong and a failure, end quote. Omalu later partnered with Julian Bales, a neurosurgeon, concussion researcher, and then chairman of the Department of Neurosurgery at West Virginia University School of Medicine, and West Virginia attorney Robert P. Fitzsimmons to found the Brain Injury Research Institute, which established a brain and tissue bank. In November 2006, Omalu published a second neurosurgery paper based on his findings in the brain of former NFL player Terry Long, who suffered from depression and committed suicide in 2005. Though Long died at 45, Omalu found tau protein concentrations more consistent with a 90-year-old brain with advanced Alzheimer's. As with Mike Webster, Omalu asserted that Long's football career had caused later brain damage and depression. Omalu also found evidence of C.T.E. in the brains of retired NFL players Justin Sezerlik, died 2004 at 36 years old, Andre Waters, died 2006 at 44, and Tom McHale, died 2008 at 45. In the summer of 2007, Bayless presented his and Omalu's findings to NFL Commissioner Roger Goodell at a league-wide concussion summit. Bales later said that the research was dismissed. The NFL's MTBI committee chair, Dr. Ira Kassan, told the press, quote, "In my opinion, the only scientifically valid evidence of a chronic encephalopathy in athletes is in boxers and in some steeplechase jockeys," end quote. The NFL did not publicly acknowledge the link between concussions sustained in football and long-term neurological effects until December 2009, 7 years after Omalu's discovery. However, as late as 2013, the annual meeting of the American Academy of Clinical Neuropsychology included a debate between two sports concussion experts regarding the validity of C.T.E. Finally, in March 2016, the NFL's Senior Vice President for Health and Safety Policy, Jeff Miller, testified before Congress that the NFL now believed that there was a link between football and C.T.E. Omalu has also discovered C.T.E. in the brains of military veterans, publishing the first documented case in a November 2011 article. Omalu found evidence of C.T.E. in a 27-year-old Iraq war veteran who suffered from post-traumatic stress disorder, also known as PTSD, and later committed suicide. Omalu's paper links PTSD to the C.T.E. spectrum of diseases and calls for further study. Omalu is lead author in a study published in November 2017 that for the first time confirmed C.T.E. in a living person. A chemical tracer, FDDNP, binds to tau proteins detectable by positron emission tomography and associated with distinctive topographical distributions characteristic of C.T.E. Tested on at least a dozen former NFL players, it was confirmed post-mortem in former linebacker Fred McNeil. Omalu's efforts to study and publicize C.T.E. in the face of NFL opposition were reported in a GQ magazine article in 2009 by journalist Jean Mary Laskus. The article was later expanded by Laskus into a book, Concussion, and adapted into a film of the same name, where Amalu, portrayed by Will Smith, is the central character. The film has been criticized for not being truthful to the actual events. Nevertheless, the movie's production led to the creation of a foundation named after Amalu to advance C.T.E. and concussion research. In March 2018, Omalu conducted an independent autopsy of Stephon Clark, who had been shot by Sacramento police officers. On March 30th, he released his findings, stating that Clark had been shot 8 times from the back or side, adding, quote, "You could reasonably conclude that he received 7 gunshot wounds from his back," end quote. Another victim of C.T.E. was New England Patriots tight end Aaron Hernandez, who some researchers say had one of the most severe cases of C.T.E. when he died at age 27. According to the New York Times, the brain scan came as a surprise even to researchers who for years had been studying the relationship between brain disease and deaths of professional football players. Aaron Hernandez, the former New England Patriots tight end and a convicted murderer, was 27 when he committed suicide in April. Yet a posthumous examination of his brain showed he had such a severe form of the degenerative brain disease C.T.E. that the damage was akin to that of players well into their 60s. It was a lawyer for the family that said, in announcing the findings on a Thursday, quote, "the most severe case they had ever seen in someone of Aaron's age," end quote. C.T.E. or chronic traumatic encephalopathy has been found in more than 100 former NFL players, some of whom committed suicide according to researchers at Boston University. Yet the results of the study of Mr. Hernandez's brain are adding another dimension to his meteoric rise and fall that could raise questions about the root of his erratic, violent behavior and lead to a potentially tangled legal fight with the NFL, the most powerful sports league in the United States. The league had already faced public relation problems after other high-profile players were found to have C.T.E., including Junior Seau, Ken Stabler, and Frank Gifford. Mr. Seau, along with Dave Durson, Andre Waters, and Ray Easterling, among others, killed themselves. For years, Mr. Hernandez was held up as a particularly egregious example of NFL players running amok off the field. Just 10 months after he signed a $40 million contract with the Patriots in 2013, with the promise of becoming a superstar, the body of a friend who had been shot multiple times was discovered. Mr. Hernandez was convicted of the friend's murder and later accused in 2 other killings from 2012. Just days after that acquittal in that case, he hung himself with the bedsheet in his prison cell. While researchers do not make a direct link between Mr. Hernandez's violence and his disease, but C.T.E. is often marked by problems with controlling aggression and impulses, and some agree of dementia, as well as mood swings, lapses in judgment, and a disorganized manner. The NFL did not comment on the medical finding, and it declined to comment on the suit. The Patriots declined to comment. Soon after the arrest in 2013, the team distanced itself from him, buying back more than 1,200 Hernandez jerseys from fans. The trauma to Mr. Hernandez's brain raises fresh questions about the dangers of playing tackle football. Other researchers at Boston University published research that found that adults who began playing tackle football before they were 12 years old developed more cognitive and behavioral problems later in life than those players who started tackle football after they reached that age Mr. Hernandez played football as a teenager. The fact that Mr. Hernandez also led a troubled life off the field will complicate the NFL's effort to calm jitters about the sport, because it would probably make some people wonder whether football had a role in his violence away from the game. Mr. Bays said that in hindsight, Mr. Hernandez's family had witnessed him act in ways that were consistent with the person found to have C.T.E. Quote, "but you don't know," end quote. The slides of Mr. Hernandez's brain samples were unambiguous and graphic. Dr. Ann McKee, chief of neuropathology at the VA Boston Healthcare System and director of the C.T.E. Center at Boston University, examined his brain and said in a statement that Mr. Hernandez had, quote, "early brain atrophy and large perforations in the septum pellucidum and central membrane of the brain," end quote. The slides also showed what she called classic features of C.T.E. in the brain, including deposits of tau protein in the front lobes of the brain in nerve cells around small blood vessels. The NFL released a statement in regards to C.T.E., and in 2016, the NFL pledged $100 million in support for independent medical research and engineering advancements in neuroscience-related topics. This is in addition to the $100 million that the NFL and its partners are already spending on medical and neuroscience research. Skepticism rose within the public and concerned medical professionals in the lack of attention the NFL was showing towards the fatal issue of specifically C.T.E. A report by ESPN's Mark Fanaru and Steve Fanaru showed that the skepticism was warranted. The NFL has used the money to fund exactly one study so far. However, and it doesn't involve football. The study is on horse jockeys, and it is being conducted in-house by researchers who appear to have already made up their minds about concussions and chronic traumatic encephalopathy, also known as C.T.E. Even if the people running the jockey study weren't seemingly predisposed to downplay the effects of head trauma, the fact that the NFL is supporting a study of jockeys is problematic. Football players, particularly those who play in the trenches, endure and impact every snap of every game. They play for at least 16 games in 17 weeks during the NFL season. According to one concussion expert interviewed by ESPN, comparing a football player to a jockey would be like comparing apples and pears. Quote, end quote. The NFL has a history of supporting concussion research, but only when that research supports what they would like to believe. It infamously gave $30 million to the National Institutes of Health in 2012, only to pull $16 million of it because it didn't like the man leading the research. The NFL partnership with the NIH is now expiring, with more than half of the pledge going unused. The NFL's approach to head trauma was already perceived comical to concerned researchers. It had conveniently left out more than 100 concussions from a database it used to downplay the frequency of head injuries. It relied on faulty data to claim that its heads-up football program worked, when in truth, there was no correlation between the program and fewer concussions. And it relies on a concussion protocol that is woefully inadequate for the job it is tasked to do. The fact that the first study conducted by the NFL into concussions is about jockeys is very telling. Now it is even more clear that it simply doesn't give a shit about its sport or the people who play it. log on to patreon.com or paypal.com and invest in me and my channel. Subscribe for more videos.